Welcome. I hope you're having an absolutely fabulous day. Whether you're a new grad or a seasoned clinician, you're no doubt feeling an incredible squeeze between time-based productivity measures on the one hand and your desire to enhance your relationship with patients and optimize outcomes on the other. It all seems so very challenging, and it sometimes seems like everyone's in the same boat. But then how do you explain when some clinicians seem so enthused and positive about what they're doing? They're under the same time and productivity pressures. Or better still, how do you explain why some clinicians, hospitals, or healthcare organizations are thriving while others are struggling? Why is it, for example, that some organizations and clinicians involved in physical therapy are beating the statistical odds that tell us that 20% of patients leave within 3 visits and 70% fail to complete their full course of care? They have the same state-of-the-art equipment, have clinicians with the same technical skills or knowledge, have access to the same treatment options. They're just like everyone else. So what are they doing differently? My name is John Spencer, and I'd like to share with you my thoughts on what they're doing differently to be successful, as a person looking at this from both a patient's perspective and someone who studied, taught, and put into practice group dynamics. I'd like to tell you a story that profoundly shaped my view of what's at play here and the connection to group dynamics. My wife recently developed a problem with her knee. She was referred to an orthopedic physical therapist by her nurse practitioner, and an initial telephone consultation was set up, and I listened in on the call because my wife said she didn't want me to miss anything. And yes, we did let the therapist know that. But before I share that conversation with you, I'd like to first give you a hypothetical example of what might have taken place in this call if it was done quite differently. Here's the hypothetical call. So let me explain what's going to happen. First, I'll do an assessment, then I'll put together a treatment program that you can use. After a couple of visits, I'll check to see what progress you're making, and then I'll make a determination on how things are going, and if it's not so good, I'll see what else I can do and recommend. Okay? And the patient says, sure. Now, my wife had a very different experience with her call. The therapist set the table very differently about the treatment process. Here's how the conversation actually went. Let me tell you how we'll go about this. I like to think of us as a team and that we'll be working together to find ways that we can be successful. First, we'll have a discussion about what's going on. Then we'll see if we need to have some tests done, so we'll have some more information. Then we'll put together a treatment program that works best for you. And after that, as we go along, we'll keep revisiting it to see where we're at and make sure we're on the right track for success. Sound good? And my wife said, sounds great. Okay, my wife's voice is higher than mine, but I think you get the idea. Totally different reaction, right? So what's at play here? Why did my wife feel so good about the call? What potentially was happening in the hypothetical call that left the client so uninspired? This one call gave me the eureka moment where I discovered one very powerful thing that any clinician can do to inspire patients. And here it is. Maybe you heard it as well. My wife's conversation had a lot of, we will do this, and then we'll do that. There was a constant and very conscious effort to just say we. That is the secret sauce behind all of this. Just saying we helps create a strong sense of team from the outset, and you can be very instrumental in building a relationship with a patient right from that very first interaction. Leading clinicians understand the value of relationship building in spades and how important it is to impress on patients that they're not just a number on a schedule. And studies suggest that their focus on relationship building is one reason why they're succeeding in and not only beating but crushing the statistics on client retention, referrals, and outcomes. How does this happen? I'm not sure specifically what these clinicians are doing, but I'm confident that just saying we can go a long way towards helping you to create a strong sense of team. Here's the best part. None of what I'm telling you is my opinion. It may sound simple, but it's far from simplistic. As it turns out, what's at play here is based on sound principles related to group dynamics and teamwork. Group dynamics that take place one-on-one between the clinician and the patient. Let's take a closer look. You see, the definition of a team is two or more people working towards a common goal. So if you consider that a clinician and their patient are a team of two working towards a common goal of positive outcomes, then it stands to reason that group dynamics comes into play here. So why hasn't this been thought of in this way before? Because when you think about it, most of us have been conditioned to think that group dynamics only comes into play in a group setting with more than two people. For example, when a team of 4 or 5 clinicians are engaged in an interprofessional team meeting, or when you see the ubiquitous poster on a wall showing 8 rowers forming a team and a quote about, come on, pull together as a team. However, think of examples in life where 2 people have formed a team and been amazingly successful. Banting and Best, who discovered insulin. Orville and Wilbur Wright, who had the first powered flight. Bill and Melinda Gates and their fight to eradicate polio. All are part of a team of 2 where group dynamics have come into play between them in order to inspire each other and contribute to their success. This is a complete rethink about how all of this stuff works. So let me show you really quickly how a group dynamics model for a team of 2 works in a patient-clinician scenario. Building a trusted relationship and an emotional bond is key. And although there are many ways to build those relationships, just saying we is a great way to convey the notion of team. For example, if a clinician is doing rounds in a hospital setting, just saying, how are we doing today? Or if things aren't going too well, say, okay, what if we try something a little different? Or like my dentist, Dr. Solly, said when he called me 2 days after my root canal, how are we making out with that tooth? How are we making out with that tooth? And when you think about it, the power of just saying we to give a sense of team goes beyond healthcare providers. For example, we the people, the start of the Constitution, or even we the North for a basketball team. Okay, you get the idea. This subtle yet powerful nugget of an idea may explain why some clinicians are often able to inspire patients where others aren't. So what's the bottom line here? Bottom line, you can inspire patients and clients to optimize outcomes by helping them feel part of your team. Interpersonal interactions have a tremendous impact on a patient's experience, often overshadowing the skills of the treating clinician. Clinicians who are great in the eyes of their patients begin that human touch from the very first interaction they have and cultivate it as they go along. And you can too by just saying we. Thanks for watching. I hope you have nothing but the best in whatever way you're making a difference in people's lives, because what you do matters. And I sincerely hope in some way this small idea may contribute to your success. Stay safe until we meet again.